Good day. I am here to do the CBB or complete bed bath. Complete bed bath is the act of washing the body with soap and water while the patient is in bed. Before beginning the bath, determine the vital signs, other care of the patient is receiving as röntgenography and physiotherapy. Aspects of the patient's health status that affects the bathing process. Explain the procedure to the client. Inspect the linens and determine which linen needs to be changed. Clear bedside table. Table cover should be removed after clearing table. Line the tabletop with newspaper before placing bath basin on it. Close the window and door to make sure the room is free from draft. Screen patient, especially if he is in a semi-private room or ward. Offer the patients a bedpan or a urinal or ask whether he or she wishes to use the toilet or commode. Wash hands or sanitize your hands using in alcohol to avoid cross-contamination. Prepare and bring all the necessary articles to the bedside. Arrange linen in order of use on a chair. Adjust bed to appropriate height. And you need to ready the 3 basin with water. The first basin is used for wetting, next is soaping, and the third is for the rinsing. Loosen top bedding at footbed. Place bath blanket over the top sheet is being removed. Fold top sheet and place on chair. Let the patient hold the tip of the bath blanket. And fan folded. And slowly pull the bath blanket. Assist patient to move to side of bed nearest you. Remove clothing, keeping patient covered with bath blanket. Avoid exposing the patient unnecessarily. If patient arms or shoulder is injured, begin removal of clothing from uninjured side. Place bath towel under head and face towel under chin. Make a bath mitt with the washcloth in a rectangular method. Your bath mitt should have 4 sides, 1, 2, 3, and 4. The side of your bath mitt should only clean one area. Wash region around the eyes with clear water. Wipe from inner cantos outward and use a separate position of the washcloth for each eye. Wash face, neck, and ears thoroughly with soap and water. Rinse well, then dry. Consult patient first as to his preference before applying soap to the area. Use firm, gentle motion on face using upward stroke. Clean ears well, rinse off soap thoroughly, and dry area well. Remove face towel and place over rack. Remove bath towel under head. Uncover further arm and place bath towel lengthwise under it. Wash the arm with soap and water using firm long stroke from distal to proximal areas. are paying particular attention to the axillae. Rinse well and dry. Every time you change bath mitt, you should cover the body where you clean. Do the same procedure for the nearer arm. Place a towel directly on the bed and put basin on it. Place patient hands in the basin. Assist him her to wash, rinse, and dry them. Pay particular attention to space between the fingers. Then change the bath water. Cover chest and abdomen with bath towel and fold back blanket down to the pubic area. Soak chest and abdomen, working under towel, rinse well and dry. Cover area with bath blanket. Pay particular attention to the navel and to area under breast of female patients. Remove bath towel and place back the bath blanket. Turn patient on his side. Have patient's back towards the nurse with body slightly diagonal to bed. Turn patient on his side. Have patient's back towards the nurse with body slightly diagonal to bed. Place bath towel lengthwise on bed alongside back and soap area, including back of neck. Rinse thoroughly and dry. Place bath towel lengthwise on bed alongside back and soap area including back of neck. Rinse thoroughly and dry. Then do the back rub. And then remove the bath towel and place back the bath blanket. on patient's gown or pajama top if any. Then move the patient in a supine position. Then you need to change the water for bath. Bath, tie, and legs in the same manner and order as the arms, paying particular attention to the inguinal areas. Drape bath blanket around groin. Flex patient knees and wrap blanket around legs. Have edge of blanket come just below knees and be sure patient is unnecessarily exposed. Place bath towel under feet. Place basin on towel. Put feet flat into basin. Feet may be placed in basin one at a time. Avoid pressure on patient calves and ankles. Wash feet thoroughly with soap and water using washcloth. Particularly attention should be given to areas between toes and heels. Remove feet from basin by placing one hand under patient legs while the other hand draws basin out. When washing one foot at a time, place clean foot on bath towel before proceeding with other foot. Lotion may be applied to rough and callous areas. Dry feet paying close attention to the areas between toes. And then remove bath towel and place back the bath blanket. Bring basin and washcloth to utility room. Clean washcloth and basin well with soap and water. Refill basin with water. Bring washcloth and basin back to the patient's unit. Place needed articles within reach of patient and instruct him or her to finish bath or crotch care. Finishing the bath is the term used to wash the genital area. This is done by the patient. The nurse may leave the unit, placing a cold bell within easy reach while patient is finishing the bath unless his or her condition requires the nurse presence. If the patient is unable to finish the bath, the female nurse does this for female patients, while a male nurse or orderly may do it for male patients. Careful cleansing of the hands must be done by a nurse or orderly afterwards. Have patient wash his hands. While patient is finishing his bath, the nurse brings in a small pitcher of water to wash patient's hands with. Put on rest of clothing if any. Make the patient's bed. Do hair and nail care. Make patient comfortable in bed. Do aftercare of unit. Clean equipment, use and return to their proper place. Then, wash hands or sanitize your hands using an alcohol to prevent cross-contamination. After, chart the following: time bed bath was given, sign and symptoms observed, complaints made, and the condition of the patient.